Flat feet do not just change the shape of your foot, they change how every step feels. Over time, that means achy feet, tired legs, and arches and heels that never quite get a break. With 30 years of assessing gait, casting orthotics, and fitting them into a wide variety of footwear, I've seen this pattern hundreds of times. These symptoms are linked directly to flat feet, and the right custom orthotic can relieve them fast. In this video, I will help you answer one simple question. Do you actually need custom orthotics for flat feet? By the end, you will know whether custom orthotics are the right solution for you, so keep watching. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with a background in gait analysis, biomechanics, and neurology. I focus on solving spinal problems that develop from an unlevel foundation, including anatomical short leg, spinal and pelvic misalignment, poor posture, and foot dysfunction. This channel is for people dealing with chronic back pain, sciatica, neck pain, headaches, or ongoing posture issues who want more than just temporary relief. Here you will get a clear step-by-step strategy that addresses the root cause of your symptoms, so you can stop guessing and start making real progress. If you're looking for lasting pain relief, better posture, and a clear understanding of what is actually causing your symptoms, subscribe and start building a stronger foundation from the ground up. I upload a new video every week. If you're watching this video, you probably already know that you have flat feet. What I want to do first is show you what I look for as a chiropractor when a patient comes into the office complaining of dropped arches or flat feet. Before recommending anything like custom orthotics, the most important step is a thorough and proper foot and gait analysis. The foot and gait evaluation is what determines the true necessity for custom orthotics. I'll walk you through the same assessment I use in the clinic. And as we go through it, I'll also show you a few simple ways that you can check your feet at home so you can get a good idea of what's actually happening with your arches. When assessing the foot for overpronation, the first thing we'll do is have the patient stand and just observe what the foot looks like. We'll observe what the heel looks like, whether it's lined up and down, whether it's tipping to the inside, or possibly even tipping to the outside, which is called tipping the inside overpronation or rotating out supination. Then we'll look at what the forefoot and arch are doing. If they're rolled to the inside, the arch is collapsed, the long arch along the inside of the foot, and also what the front of the foot is doing. Once we've observed that for both the right and left feet, we'll have the person walk and assess what the heel and the forefoot are doing from the front and from the back. So as they walk away, we're looking at what the heel does, how it strikes and how it rotates, possibly as they step. And then as they come forward, we'll assess on the same foot what the front of the foot's doing. We'll have them do this multiple times so that we can assess what it looks like on multiple occasions and get a good understanding of what the mechanics of the foot are actually doing. So as they walk away, we'll watch the right heel as it strikes and rolls. And then as they come back, we'll watch the right forefoot as it comes forward towards us and observe what the arch and the ankle and the foot are doing. After they've done this a couple times, then we'll look at the left foot and we'll observe the same thing. Watch for what the heel strike looks like, if the heel rotates, and then as they come back, again, look at the forefoot and what it's doing. At the same time, we'll also observe the knees and watch what they're doing. If the arch of the foot is pronating or overpronating, a lot of times what you'll see is the knee will tip to the inside. This is called genu valgus, and it puts stress on the inner part of the knee. But overall, this is what the gait assessment will look like. A self-assessment technique you can do at home to check and see if the plantar fascia, which is the band that runs across the bottom of the foot, is inflamed, is to cross one leg up across the other. Use your hand to pull your toes back to put tension on the plantar fascia, and then take your thumb and run it along the fascia. The band should feel fairly smooth and painless, but if you find that there's nodules in it or particularly tender spots, that's a good indication that the plantar fascia is being stressed from overpronation or from having a flat foot. This is where an orthotic will be beneficial. Flat feet are more than just a foot shape. They change how your entire body handles load. When the arch drops, the foot tends to roll inward. This is called overpronation. It might not sound like a big deal, but that excessive inward motion changes how your force moves up through the entire body every time you stand, walk, or run. Think about how many steps you take in a day. Hundreds, thousands, sometimes tens of thousands. Now imagine that excessive inward motion happening with every step. Over time, that creates extra strain, not just in the foot, but up the entire chain. This is something I see regularly with patients. Many people come in complaining of achy, sore feet. Others describe tired legs after standing or walking. Some notice arch soreness that builds through the day. And a very common one is heel soreness, especially first thing in the morning or after being on their feet for a long time. But it often doesn't stop at the foot, because the feet are the foundation. When the foundation becomes unstable, the rest of the body has to compensate. The ankle rolls inward, the lower leg rotates, the knee tracks differently, and the hips and pelvis may shift to adapt. Have you ever noticed knee discomfort that seems to come and go, or low back stiffness after a long day on your feet? Sometimes the starting point of these problems is much lower than people expect. This is where many patients get stuck. They focus only on where the pain shows up, but the underlying issue can actually be how the foot is functioning. When flat feet and overpronation continue for years, that repeated strain can contribute to problems like plantar fasciitis, tendon irritation, joint stress, and ongoing foot fatigue. So the real question becomes this: if flat feet are putting that much extra strain on your body with every step that you take, what actually helps to fix the problem? For many people, the answer is custom orthotics. A custom orthotic is designed specifically for your foot structure and the way your foot moves. Instead of generic inserts, it provides targeted arch support that helps to guide the foot in the most stable position. That support helps the foot to function the way it was meant to. It can improve alignment, stabilize the heel, and distribute pressure more evenly across the foot when you stand or walk. And that matters because when the foot becomes more stable, the muscles and joints above it don't have to work nearly as hard to compensate. Many patients notice less foot fatigue, less strain through the legs, and better overall comfort when they're on their feet throughout the day. Custom orthotics can be especially helpful when people experience ongoing discomfort when the foot consistently rolls inward, or when the over-the-counter inserts simply don't provide enough support. They're also valuable for people who are very active or spend long hours standing or walking because they improve the stability and help the foot handle repeated load much more efficiently. And importantly, orthotics are not only for people who already have significant pain. Even when flat feet are not currently causing major symptoms, supporting the arch properly can still improve how the foot functions and help reduce long-term strain on the body. That's why for many people with flat feet, custom orthotics become the most effective way to support the foundation of the body. You now know how to screen yourself for flat feet at home, why flat feet can be a problem that goes far beyond how they look, and when custom orthotics may be the right solution. But remember, it's always best to get checked by a doctor or qualified health practitioner who can properly assess your feet, your gait, and how your foundation is affecting the rest of your body. If you got value from this video, like and share so more people dealing with achy feet, tired legs, ongoing arch or heel soreness can find real answers. And if you have any questions about custom foot orthotics, feel free to leave them in the comments below. And remember, if you're looking for lasting pain relief, better posture, and a clear understanding of what is actually causing your symptoms, subscribe and start building a stronger foundation from the ground up. Flat feet can also be a hidden cause of back pain. So if you have flat feet and back pain, watch the next video where I explain how problems in your feet can travel up the body and contribute to back pain. Go watch this video next.